Great. Hello, everyone. This is Stephanie Vance. We're going to go ahead and get started. We've got a few more people popping into the call, but I want to make sure that we respect everyone's time, so we're going to get started here. Just to make sure, again, that the audio is working, if you can find the raise your hand button on your screen and click on that just so I can make sure that you can hear me. And I promise the incessant hand raising will not go on throughout the entire webinar. All right, great. I've got hands raised, so I think we're in good shape. And I will give you all the details about how all of this works in just a moment. But for now, I want to welcome you and really appreciate you all being here in the context of your support group. We really feel like advocacy is critical, and it's not something that we should go alone. So we've got some ideas here for you to quickly and easily mobilize your support group for some maximum impact. And I'm going to give you 10 of those, and you'll come away with a plan for getting started. So speaking of getting started, our topics today, we're going to talk about what we mean by advocacy and what audiences are involved, why policy advocacy is so important, and that's what we're going to be talking about today, some ideas to engage support group members, and your checklist. So as promised, starting with about the webinar, basically everyone has joined in a mute-only mode. And the reason why we do that is because we want to mitigate any background noises. But you can ask questions. You should see something on your screen that looks like a questions box. And if it's not, there's a word that says questions. You can hit the plus sign next to that. And when you do, the box will open and you can type in questions to me. I will be checking on those periodically. And I'll also ask you every once in a while to, anytime I ask for a comment, you can put your comment in the question box. There is also a chat box, and you can use that as well, whichever you prefer. Now, one of the questions I always get is whether this is going to be available after the session, and it will be. We have a whole webinars page on the Stroke Advocacy Network site. So the PowerPoint, the materials I'm going to be showing you, and the recording is going to be available. That said, hopefully you'll be taking some notes because there's nothing like being here live. All right, so who's speaking? The disembodied voice you're hearing. My name is Stephanie Vance, and I've been very pleased to be working with the National Stroke Association, and particularly the Stroke Advocacy Network, for a number of years now. You can see my beautifully airbrushed picture there. I swear my photographer makes me look better than I might in person. Some background on me: I used to work for Congressman Earl Blumenauer. I worked for 2 other members of Congress. I was a staff director and legislative director on Capitol Hill. I used to be a lobbyist for National Public Radio, which you either love or dislike. And I've also written 5 books on effective advocacy. So I kind of tend to see advocacy from the perspective of the people being advocated at. And we'll talk a little bit about what that means when we get started. But I do want to actually have your fearless leader, Coral Causeway, give you a quick welcome, because you are not officially welcomed until Coral welcomes you. So Coral, I'm unmuting your line. Please go ahead.
Well, welcome everybody. Thanks for giving us an hour of your time today. Good morning or good afternoon, depending on where you are across the country. We are sitting here in Denver, so it is still the morning. Thanks for giving us an hour, and I want to make sure everybody knows this will be available afterwards, like Stephanie said, on our webpage. But the advocacy staff here at National Stroke Association is always here to answer your questions. So I believe my contact information may be put up on a slide at the end, but you can always get a hold of us at advocacy@stroke.org or call the general number here at the National Stroke Association, and we are here to answer any of your questions anytime you have them. So if you don't get a question answered today, or you think of something tomorrow, please let us know.
Great. Thank you, Coral. And I'm going to go ahead and mute your line, but if you have questions or comments as we go along, please do let me know. So let's get started. The thing I always like to start with is to get a better understanding of where you all are in your advocacy journey. So I'm going to open up a poll here, and basically I'm asking you about your policy advocacy journey. And what I mean by that is whether you've done any work talking to elected officials, staff people, whether at the state, local, or federal level, such as an email or phone call, done a visit. And if you haven't done any, that's fine as well. This will just give me a sense of where we can start from in terms of getting a message across. So I'm going to go ahead and let that poll hang out for a minute. We do not like to curtail democracy in D.C., although I know sometimes it feels like it lately. Trust me, I'll tell you what's going on here at the end. All right, we've got 72% of the votes in. 79. I'm just going to make sure everyone has their chance. All right, we have over 80%. You guys rock. I'm going to go ahead and close the poll and share the results. So we've got a mix of folks who haven't done haven't done really any advocacy, some who've done a little, and some who've done a great deal. So we'll tailor the discussion to that. If you've done a great deal and you'd like to add in some comments, please do, because I really like to make sure that the people who've done it can give us a sense of how it works in your own communities. All right, so that's where we're starting from. Now, I want to make sure that we all are on the same page in terms of what we mean by the word advocacy. And it's something, obviously, that you all do every single day. You're advocating in terms of supporting other stroke survivors, or you're working with a stroke survivor. You're advocating with health insurance companies and doctors and hospitals and care providers. And to me, advocacy is really pure and simple about pleading or arguing for a cause. And the cause can be different, and it can be a variety of different audiences, but advocacy in and of itself is that, pleading and or arguing for a cause. Now, to me, the differences in advocacy are who the audiences are that you're talking to. So sometimes you may be advocating at employers in terms of return to work issues. Sometimes it may be benefits administrators, doctors, insurance providers, and I know I haven't put them all up here. But the one in red is the one that we're focusing on, which is policymakers. So the skills that we'll talk about in terms of communicating with policymakers can translate into other kinds of advocacy. But I mention that because if you have questions very specific about, a certain insurance benefit or that sort of thing, we may not be able to answer it on this call, but the skills we talk about here will probably help you a little bit in that context. But hopefully we're all on the same page as to what we're talking about in terms of advocacy. Now, before you think, well, the kind of advocacy I do, it's different, doesn't matter, this actually, policymakers impact stroke survivors in a variety of ways every day. Right now, one of the big things that we're talking about is the elimination of the exceptions process for therapy caps. And this will actually have a dramatic impact on care, even when it's medically necessary. And it impacts Medicare in terms of being a direct issue for Medicare recipients, but it was obviously sets a precedent, too, for private insurers. So really, in a nutshell, what this means is currently there's a process by which if you're receiving physical, speech, or occupational therapy, if you need to go over the cap that is inherent in the Medicare benefits process, if you need to go over that cap because it's medically necessary, there is a process by which you can do that. That process expires on December 31st unless Congress takes action. So our goal right now in the advocacy world is to let members of Congress know that they need to extend, stop the therapy caps and extend that exceptions process. So we actually, how many people, if you can raise your hands, and you could raise them in your office, but I won't see you, so if you could click the raise your hand button on your screen, how many people have responded to the action alert that we have on this? Already, because we have a great action alert on the Stroke Advocacy Network site. All right, we've got a few people who have already responded. If you haven't, very simple to do, and remember, as a leader of a support group, it's not just you, but it's others that you can get engaged. So the very simplest thing to do, if you have not done this yet, is to go to stroke.org, click on the Advocate button, and then when you get there, you get to the Stroke Advocacy Network homepage. Now, I know a lot of you have been here. Then you, under Speak Out, you'll click on the link that says Take Action on Federal Issues, and you'll see our current action alerts. The one I'm talking about right now is the Preserving Access to Medicare Therapy Services. And when you click on that, it will have a description of what this is. Now again, for those who are thinking, well, that has the word Medicare in it, so it doesn't impact me. While it doesn't directly impact private insurers, a lot of private insurers do take their cues from what Medicare is doing. So definitely everyone needs to be communicating on this one, whether you are under Medicare or not. So that's one thing that is something how policymakers impact stroke survivors every single day, a critical one. Another one is reduced funding for NIH research, and that's the National Institutes of Health, at NINDS, which is the National Institute of Neurological Diseases. Wait, maybe I didn't get the whole thing. But at any rate, what will happen with that is the reduced funding will mean that there will be fewer findings. And when I was putting this presentation together, I saw a fascinating article in the Washington Post, Brain Flushes Out Toxins During Sleep. And, you know, recognizing that that's not directly stroke related necessarily, this is the kind of interesting thing about sort of mapping the brain and understanding the brain, and particularly some of the impacts that it might have on stroke survivors, that NIH is working on. And if we don't let legislators know it's important, then we'll find that they may be willing to reduce the funding, especially in these times of difficult economic need for a lot of different folks. So this is the NINDS, National Institute of Neurological Disorders and Stroke. And that's reducing the burden of neurological disease. That's where I was getting the disease from. But you'll see if you want to learn a little bit more about it, here is a page that has the funding strategy for 2013. And easiest way to get to it is through the NIH website, which is nih.gov. And we also will have these URLs available for you after the session. So those are two ways that policymakers impact stroke survivors. And another way is you've probably heard of the BRAIN initiative. And if you haven't, you can learn a little bit more about it on the stroke site. This is something that's been proposed by the administration to increase core research on brain function. And this is something that your Executive Director of the National Stroke Association, Jim Baranski, was actually at an event at the White House regarding this. So this is really critical to stroke survivors. And the good news is that along with the therapy caps and the funding issue, we do have another action alert on this. So you will see if you go to that stroke site that we went to earlier. So again, that's just stroke.org. Click on this Advocate button, click on the Take Action on Federal Issues, and you'll see some information on all of these. So the stroke-related medical research is NINDS and the brain research. So take a look at these. If you haven't responded, please do. It's critical that we actually get these communications into legislators' offices because they definitely need to hear from their constituents. Now, of course, one of the other things that we have been hearing a lot about is the Affordable Care Act, how that impacts stroke survivors. And the key thing there is the no pre-existing condition provision that says that insurance providers have to cover you, even cover pre-existing conditions. And, you know, however you feel about that particular bill, that is obviously something that impacts stroke survivors. And the reason why I raise that is because I just want to make sure people understand that this is the advocacy to that audience of the policymakers does impact you as it moves from the federal level down to the state and local level. So while your day-to-day advocacy may feel like, you know, hospitals, benefit administrators, insurance providers, these policy decisions are going to impact that. So that's why, to me, policy advocacy is so critically important. All right, so I want to talk about our 10 things that you can do with your group to make sure that they're being effectively engaged in the process, and some quick and easy things that you can do to mobilize them. As I get ready to do that, I'm going to check to see if we have any questions at this point. And here's a question that I think is a medical question that we'll need to see if we can address at some point after the session, which it relates to aphasia after a stroke. And the thing I will say about that is that NIH, those are the kinds of things that NIH and NINDS are looking into, and without the funding, we will not be able to answer some of the questions that you all have as sort of a direct medical issue. So this is why it's so critical to go to those action alerts and respond to them. All right, so for your group, if you're leading a group, if you're a member of a group, if you've heard of a group, if you like groups, one great thing to do is at your next meeting, set up a computer to respond to the Stroke Association alerts. All you need to do, you have an internet connection, put everyone on stroke.org, you click on the Advocate button, and anyone can respond to these alerts. So the more materials we get into a legislator's office, the more information we're going to be able to use to convince them that these funding provisions and that these policy provisions are critical to their constituents. So that is one great thing to do. Very simple, very easy. Set up the computer, you have your discussion, and then you can during a break ask everyone to send their letters through the Action Center. All right. So action item number 2, and this is something that could be part of a meeting. Maybe you could spend 10 minutes doing a little bit of research on your legislators. Some of the key things to understand, and I'll show you some of the ways that you can find this out, is how they talk about issues, some of the bills they've introduced, some of the demographics of their district, what they say on the various social media sites, and some of their voting records. Now, through that stroke.org site, the Advocacy Network, you will be able to find your specific legislators, and I'll show you specifically how to do that in a moment. But right now, I just want to show you how I would use a legislator's website to specifically track down all of those things that I said were important research items to know. Now, I use Mr. Bennet, Senator from Colorado, because that's where the National Stroke Association is headquartered. So, when I take a look at his site, basically, if you're not sure who your federal House representative is, you can always look up your senators pretty easily, as long as you know what state you live in. So hopefully we're all on board with that. And I'll show you how to look up your specific House representatives. Remember that every citizen of the United States has one federal House member and 2 senators, and the senators represent the entire state, and the House member represents specific districts. The National Stroke Association is also working on state legislative initiatives. In a moment, I'll show you how you can take action on some of those state issues, although for right now, the legislatures are generally closed, so there may not be specific action alerts there. But let's just take a look at U.S. Senator Mr. Bennet. Now, as a U.S. Senator, he's going to be voting on things like funding for NIH. He's going to be one of the people who's thinking about that exceptions process. So he's going to be one of the ones that if you live in Colorado, you're really going to want to communicate with as much as you can. Now, for him, when I was mentioning how you find out about some of his legislation and issues, almost every legislator I've seen has an issues tab on their website. And you scroll over it or you click on it, and you'll get a lot of details about some of the ways that they talk about different issues, and you'll usually get a list of the legislation that they've introduced. So when I click on that list of legislation, you'll see there's a huge number of different bills. But when I take a look at some of these bills, it gives me a sense of some of the things that he might be interested in connecting with you on. So, for example, when I looked at this earlier, I saw some the No Child Left Inside Act, which I thought was funny. Has to do with childhood exercise. Military Reserves Jobs Act, that seems to be veterans related. There is one about school access to emergency epinephrine that is also healthcare related. Now, when I mention these things, you may look at this and see, well, I don't see the word stroke in anything that he's introduced. What we're doing here is to really see what he has introduced, so we might be able to tie some of our issues to the things that he already cares about. So in order to do that, I've taken a look, as I mentioned, at his legislation and kind of made a little chart for you because I'm kind of the chart person on some of the different things that we can find out about them, and you can do a very similar chart for yourself. So Mr. Bennet, we've seen what bills he's introduced. He's doing some work supporting our troops, so maybe you've got some veterans in your support groups who may be people who could communicate with him. Healthcare services in schools, maybe you have some schools, some teachers who are connected with your support group who might be people who can deliver that message. No Child Left Inside, exercise programs for survivors, some of the work in your support groups, increasing exercise. When you look at this, again, you may think, well, what we want to talk about is not specifically that, but what you're doing is tying this support group concerns back to the legislator and the things that he or she is interested in. So if we know that they are very interested in supporting our troops, and we have veterans who also share that interest, the veterans can go talk to the legislator and say, but you know, one of our big problems is having enough access to therapy services, and segue into the therapy caps issue. And you know, also whenever you're communicating with someone, it's just a good idea to have an idea of some of the things they're interested in. Now also, under the Issues tab, I found a couple other little things that might be interesting. So when I clicked on his health link, I saw he has this, he's talking about the Affordable Care Act and how to get connected to that in Colorado. So this might be able to help uninsured folks, you know, those who are uninsured, those who are in need of additional care. And so you may have people who have that problem, and so they would be good to talk with the senator. Colorado kids is a big issue under his issues page, so the connection there would be young people who are affected by stroke. Agriculture, you know, I was thinking agriculture, that seems kind of odd. How would that be connected? And then I was thinking about rural access to care, nutrition programs. You know, I know many support groups do try to help stroke survivors with their diet. And so that does connect back to some of the things that Mr. Bennet cares about in terms of agriculture. So see if you can take a chart like this, and we do have a legislator information sheet that's part of the toolkit that the Stroke Association has provided, and I can show you how to get to that in a moment. But it's a profile worksheet. You can fill it out. It will help you understand some of the things that he is interested in. Now, action item number 3, quick and easy thing to do, quick and easy thing to encourage the support group members to do, just to connect through social media. So when I took a look, and I'm not picking on or encouraging Mr. Bennet specifically, I'm just using him as an example because he's Colorado, but obviously take a look for your own legislators. So you can see up at the top of his page there'll be a Twitter link, there'll be a Facebook link, and there'll be a YouTube link. And most of the legislators are on those specific sites. So when I click on the Twitter link, of course it tells me that you're going to Twitter, leaving the Senate website. And he is a pretty good tweeter. Many legislators, you go to their site and there's nothing there for days and days and days, but Mr. Bennet, pretty good tweeter. So when you take a look at this, you'll see that he's sent a fair number of things about where he's going, what he's doing in Colorado. If you see something he's doing that you like, you can retweet that. You can send him responses. Always be nice. But you can also say, hey, for example, I saw that you were spending some time with this particular group. We'd love it if you could also come and chat with our group as well. And that's just a really easy thing to do, is to find them on Twitter and Facebook and YouTube if you're already on those, and start following them there. And in fact, if people want to jump off and do that right now, I will not be hurt at all, as long as you come back and you type in the question box, I started following my legislator. because that helps me understand that you've actually gotten at least one thing out of this. So follow them on Facebook, find them on Twitter. Most important aspects of that is to find when they're in the district and to find things that they're doing that are positive, that you can comment positively on. And I swear, if you comment positively on those items, you'll actually get attention, because most people have very negative things to say about their legislators. I know, it's shocking. Now, I'm going to go on to item number 4, but before I go on to that, I'm going to double check for questions, and I'm also going to ask if you have a website for your support group. If you wouldn't mind typing that into the Q&A box, because in a couple items I'm actually going to go through an idea I have of quote-unquote recycling advocacy. And I've got one website that I can look at and show you some of the quick and easy ways you can use what you're already doing to connect with legislators. But I also can do one live, so if you've got a website that you'd like me to take a look at and give you my advice on how I would connect with legislators through that, go ahead and type that into the Q&A box now, and then we can use those as live examples. All right, and I'm just checking to see if we have any questions. All right, I think we're good at this point. All right, so action item number 4 is newsletters and media outreach. Many support groups I know have a newsletter, or they're connected to a newsletter through a hospital, through an insurance provider, through another kind of institution. If you have one, if you're connected to one, you have the power of the press. And one great way to use that is to ask a legislator to submit an article for your newsletter, or you can write one yourself about the connections with the legislator, or you can write one about some of the important issues that are going on in D.C. that stroke survivors need to know about. So, you know, for example, you could write an article about the exceptions process, about the therapy caps, how critical that is, about NIH funding. Whatever of those items you think are most important, you could put in a short paragraph. The Stroke Association website has those talking points, so you can simply cut and paste those paragraphs and put them into your article, and people will be able to read about it that way, and then link them back to the action site. Now, also, you can ask a legislator to submit their own article for your newsletter. They love to be able to connect with all of the people in their district, and if they have an opportunity to write a short article, knowing that that's getting out to, even if you have a very small number of people in your support group, they love to be able to get people reading about what they're doing and interested in what the legislator is interested in. So, and the other nice thing about having them write an article is that then you have written evidence that they were interested in your issue. And when something comes up, for example, when the exceptions process is about to expire at the end of the year, you can go to them and say, hey, you remember this great article you wrote for our newsletter on this process? Well, now we really need you to support us on the vote. So if you have any connection to the media, newsletters, even if you feel like it's very small, it goes to only a few people, even if it's mimeographed. I know I'm showing my age when I say the word mimeograph. No matter what format it's in, you can always ask a legislator to submit an article, or again, write one yourself. All right. Now, I want to talk about that recycling advocacy idea. And to prepare ahead of time, I went and looked at the various stroke support groups that are listed on the National Stroke Association site. And if you don't know where those are, do type into the Q&A box that you'd like to find that list, because I can show you where that is. But I went and looked at that list, and I found just one great example of an organization that could recycle some of their existing efforts. So this is the Pacific Stroke Association. And when I went to their site, and I'm actually going to pull it up right now, when I went to their site, I found that they, these are some of the things that they are already working on. And they have an ability resource fair coming up in a couple days. They've got a resource directory. They've got the regional stroke conference. They've got this information on the FAST acronym that helps us understand that stroke is an emergency. We've got the newsletter that you can sign up for, so that tells me that they can do some newsletter outreach to the legislators. If you check on the support groups, they've got a lot of different individual support groups that they can connect a legislator with. One of the things that I thought was very intriguing about this particular organization is the 15th anniversary. Now, that was a couple weeks ago, but this is an absolutely perfect opportunity to go to an elected official and ask them to submit what is known as a statement for the congressional record about the 15th anniversary. It's called an extension of remarks, and actually what I'm going to do is take you to this right now because I want you to see what I'm talking about. It's a short statement that legislators can make that basically indicates their support for something that's going on in their district. And they love to do things like congratulations on the 15th anniversary of our particular stroke organization, or really anybody. They talk a lot about individuals. So you'll see here, these are all, and here's a perfect one, the 75th anniversary of the Beulah Baptist Church. Now, when this was submitted, I don't think that Congressman Miller got up in the morning and said to himself, I know, I'm going to recognize the 75th anniversary of the Beulah First Baptist Church in my district. I'm going to guess that someone from that church actually asked him if he'd be willing to submit a statement that talks about this. So if you have anything going on that's, that anniversary situation like the Pacific Stroke Association has, but even upcoming events, a legislator would certainly submit a statement to the record about an ability resource fair that your support group is working on, or anything that you're doing in the district that is helping their community. So think about that. To me, what that is advocacy recycling. You already have things going on, and so you will be able to use those as an opportunity to connect with your legislative offices. I'm going to talk about how you connect with the district offices in a moment, but really it's easy. If you wanted to invite them to an event, all you would do is call and say, would you be willing to come to our event? If you wanted them to do a newsletter, all you do is call the office and say, would you be willing to submit an article for our newsletter? And remember that your Stroke Advocacy Network team, who you can reach at advocacy@stroke.org, is always there, maybe not 24/7, but is there as much of the time as possible to help you out. So if you are intrigued by any of these things, but they seem a little confusing, because I know I'm throwing a lot of information at you, do feel free to email advocacy@stroke.org, and we can figure out how to help you with that. Now, also, if you're very intrigued by this but aren't feeling yet like you can run out there and ask a legislator to do something, remember, if you go to stroke.org and click on the Advocate page, under the Resources link, you'll see that there is an Advocacy Toolkit. And this toolkit has so many examples of some of the things that we're talking about that you will be able to find something on this page that will help you with putting together some of these materials that we've just discussed. So remember, if you want to do some of these things, don't feel overwhelmed. You've got your team at advocacy@stroke.org, and you've got this toolkit that will help you as well. Now, if someone wants me to take a look at their website and do the same little review for them, because I know everyone has got something great on their website, do go ahead and type that into the Q&A box. But in the meantime, I'm going to ask you, just thinking about your own situation, whether it's on your website or not, whether you have something already going on that you feel like you can recycle, something that you can use already to help your advocates connect with your legislators. So do you have a group meeting? Do you meet in a space we could show, for example, a hospital or a doctor's office? Do you have a newsletter? Do you have an event coming up? Come up with one, or hopefully some or all of the above, that you can use to recycle for those connections. and I'll let you all take some time to vote. And we've got 32% of the votes in, 39%. And if you don't really have any of these things, the best thing to do is to do some of those individual action alerts and encourage others to do the same. So we've got 54% of the vote in. I'm just going to wait a few more moments to see if we've got others who believe they have one of these things that they can do already. All right, 56% in. I'm going to go ahead and close the poll and share the results. So it looks like a lot of people have group meetings. Those are very, very easy to ask district staff or legislators to attend, to stop by, to meet the folks in the support group, and I'm going to show you how to do that in a minute. Got something you could show, a newsletter. Don't have a lot of events coming up, but do consider if you're doing an event, even if it's a walk or something along those lines, a fundraising event. They do love to know about those, or some or all of the above. So I think everyone, a lot of people have things that they can already implement, and if you don't remember, if you're working as an individual, you do have those action alerts that you can do yourself or share with other survivors through a support group, or you know, just tell people to do them, whether it's through a support group or not. People need to do it. All right, so that's action number 5. And action number 6 is to engage others today. We've really, you know, we've talked about doing this in the context of a support group, but, you know, you can also do this in the context of your own individual work. The way I try to describe this is you've got this decision maker in the middle of our chart here. And the decision maker is surrounded by a number of people who are going to help him or her make decisions. So policy allies, political allies, friends and family, staff, and stroke survivors and caregivers, particularly in the stroke arena. So whether it's research, whether it's the therapy caps, that is where your real forte is in terms of impacting the decision maker. And so we wanted to provide for you something that you could hand out to other stroke support group members or others that you know who have been involved, whether they're caregivers, whether they're actually members of the support group or not. And this will be available after the session. But what this is, if you're having any kind of meeting, and I notice that all of you, or many of you, are having meetings coming up, you can hand this out to the group members. So it starts with about the group, when it, you know, just a little bit about your group. You don't have to fill all of this in, but it gives you a sense of what might be useful. And then asking the group members what we need you to do. And these are very specific actions that they can do, hopefully right then and there in some cases. And it gives the resources, the links. The links go to stroke.org to see the action alerts and the videos, learn about legislators, etc. So this is a list of things that you can ask your group members to do if you want to put something on the agenda for your next meeting. Very simple, very quick, very easy. And you know, to me, I've seen this work personally. You know, several years ago, my father had cancer, and he was very engaged in a reimbursement issue for outpatient cancer treatments. And you know, he had a lot of people who were parts of groups, parts of support groups, who wanted to get engaged but didn't know what to do. And this was obviously in the cancer reimbursement issue, but this was a key thing that they needed to help others know exactly what it is that they could do to be useful. So we will have that available for you, but to me that's a critical component of number 6, which is to engage others today. Now, if you're thinking about who to engage, here are some questions about some of the ways that you can sort of consider who might be part of your network. And I do have a question here whether we have any links in Mexico regarding support groups. I'm actually going to ask Coral if there's an international link on that support groups page. if there's a way to address that question. But yes, we will try and find out the answer to that, because it's not like stroke supporters are only in the U.S. We need folks who are international. So some ideas for engaging others. Think about the usual suspects. Who already likes you? Who already uses your services? Who directly benefits from you and the work that you do? And then moving beyond, who's going to benefit indirectly? Who are some of the polar opposites in terms of the region you're working in? And there may be a reason that they might benefit from your work. In terms of looking at that benefiting indirectly and sometimes polar opposites, one of the things I suggest is to look at other patient advocacy groups and whether for other situations, and see if they might have some ways to benefit from what you're working on. So Parkinson's disease, there's a lot of research that's going on at NIH regarding that, and obviously it's in everybody's interest to increase the amount of money available, even if we might be arguing a little bit within our communities about what happens with that money. But there's all kinds of different opportunities to find some of those groups. One of my favorite things to think about is to not network, because I think that sounds like too much work. I like the idea of net play. Just try and find people who you really connect with, who you really want to work with, and then see how you all can work together. So that's just a word play on my part, but I really prefer net play because it just sounds so much more fun. And then most important when you're engaging others is that civility issue, even with those who are annoying. And I know we find that sometimes with legislators in D.C. and at the state level, but civility will get us a long way. So we could actually do a whole session on engaging others. That's all I'll say about it for now. But the key is to see who surrounds the decision maker, and then to use that resource, that handout resource that I showed you, to give them some specific things that they can do to really try and influence the policy process. All right, now a lot of you said, and I'm actually going to just double check and see if we've got any questions at this point. And I do have a quick note that right now the National Stroke Association does not have information on the international groups, but I am aware of World Stroke Awareness Day, and that's a group that's oriented around raising awareness about stroke, obviously internationally. So I can go ahead and send you that link. I don't know if they have support group information associated with, but it might be something that you'd be interested in or find helpful. All right, so action item number 7. Many of you indicated that you do have group meetings coming up, and one really quick and easy thing to do is to ask a district staff person to that. Now, a district staff person, every legislator has people in their congressional district or in their state who are there to connect with local individuals, local groups. And I'm actually going to show you quickly and easily on the Stroke Association site how you can find those district staff people, the district office contact information. So you see when you get to the Stroke Advocacy Network page, on the right-hand side, I'm clicking on a link that says Find Your Legislator. And when you get to that link, you're going to type in your zip code. And when you click on that, sometimes you might have to fill in your full zip code. In this case, I typed in one that I know is actually not the full, doesn't need a full zip code, just for purposes of showing you. But in some cases, you might need to type in the zip +4 or your full street address. Now, let's take a look. When you get to that page, you see who your legislators are, and so you know who your senators are for the state. And for this particular district, it's for the House, it's Doug LaMalfa. And when I click on that page, I get all of the contact information, including these state addresses. And the state addresses are the ones that are associated with their district office. Now, the district staff, they usually have 7 to 8 in the district office whose sole job it is to connect with people in the district, to go to meetings, to get to know local individuals, to talk with you, to try and resolve even some of the bureaucratic issues you might be having with the federal government. Those are folks who are called caseworkers who can sometimes help with that. So when I say invite district staff to a meeting, I mean go to this page, look up the district office, and then ask if a staff person can attend your meeting. And the purpose in having them there is to simply meet some of the other people who are part of the group. They can make a few comments. You don't have to have them there for the whole meeting, although you'll be surprised at how interested they are. But the purpose is to just help them understand that they have people in their community who are interested in these issues. And you can say as part of that, I recognize that the congressman is going to be working on therapy caps issues or funding issues or whichever one you're particularly focused on. So I appreciate you coming by and learning a little bit more about how these impact us. It's one phone call to one of those local offices, although you may have to leave a message and be called back. But one phone call, one email to give them the information, and if they can't attend your next meeting, they might be able to attend one in the future. All right, so that's action item number 7. Action item number 8 relates back to the engaging others action item, number 6. But this is really, we have a handout. We're going to give it to them. We're going to tell people how to directly get engaged. But we also want to make sure that they're trained. And as support group leaders, you have some real resources to do this. You can use this handout that we've demonstrated here, but we also have the recordings available through the Stroke Advocacy Network site. We have previous webinars that are basically how to respond to an action alert, how to find your legislators, and we also have a couple of video shorts that are just 3 to 5 minutes of walking through some of these details. And again, those are something if you're looking for an agenda item for your next group meeting. You can even watch one of these, even the shorter videos right then and there, and have people actually do some of the action items at that time. So that's action item number 8. Now, action item number 9, and before I go on, I'm just going to double check to see if we have any questions at this point. All right, and I have a nice comment. Kudos from Mexico for all of you. Thank you so much. I was actually just in Mexico, so wonderful country you have there. All right, action number 9, getting to know the DC and the district staff. So this is a matter of, I mentioned you call, you get the district staff to come to a meeting, and, that's a great way to start that connection. You can also call the DC staff, and the DC staff are the ones who are handling many of the policy issues that you'll be talking about. When you talk to the district staff, they tend to not be as policy focused. They may be just more connecting to people in the district. The DC staff are probably the ones who are going to handle the policy issues, and those are the ones who are going to see the letters that you're sending through the email system. But calling them is also a really, really effective way to get your message across and makes it even more personal. So it's really simple. People always get nervous about talking to their legislators, but it's really like talking to any other human being. And believe me, if you've had problems with getting certain benefits in place or getting certain coverage or getting a certain access to a certain kind of care, talking to your legislators will be a much more positive experience. So I know you can do this. But basically, here's a script. First of all, you'll call, and someone who's 12 will say, hello, this is Congressman so-and-so's office. All you need to do is to say, I want to talk to the person who's handling health care, and I say start there. Please don't read SV notes, start there. I just want to make sure you know it's health care issues you're probably starting with. And then usually I'll say they're a lot of times out of the office because they have very busy schedules, so you'll probably get into their voicemail, and I'll show you in a moment what kind of voicemail you can leave. Do be sure to see if you can get their email address as well. Sometimes the front desk won't give that, but a lot of times they will. And a lot of times these communications can be made via email. Now, by the way, I put the picture of this very young lady here because everyone on Capitol Hill is quite young. You'll want to be emotionally prepared for that, but they are the best and the brightest that you'll find. All right, so you've gotten to their voicemail and you're concerned about wanting to talk to them about some of these issues and you want to leave a message. This is a very quick script for a message. You can try and set up a call. You can try and set up a visit. You know that Representative or Senator put in their name, don't necessarily say so-and-so. Connect it back to the healthcare concerns. And you don't even have to get into too much detail on the message. You can just simply say, these are some of the things that impact us directly, and I'd like to talk with you about this and how we might improve and or protect the federal partnership. This message you could leave on a voicemail. I would bet it would take a minute and a half, if at the most. Obviously, leave your contact information, and you'll hear either back from the DC staff or the district staff. You can leave this message with either. But again, that personalized call makes a huge difference in getting your message across. All right, so that's action item number 9. Now we're up to action item number 10, and once I'm talk through number 10, I'll also tell you why this is critical now for those of you who are concerned that given the gridlock in DC, it's not a good time to do this. But I will tell you, I promise, but in a couple slides, so you got to stay for the next few minutes. All right, action item number 10, town halls. So town hall meetings are when legislators meet with constituents in their districts. They have community meetings, and they want to really talk with everyone about any of the issues that impact the community. This is a great opportunity for you to go to the town hall. If you go a few minutes early or stay a few minutes late, you can usually meet the legislator or the critical staff person, shake their hand, let them know what you're working on and how it connects to their concerns. How do they take place? There's a fair number that are in person, and when you've been following the legislator on Facebook or Twitter, you'll see that they are posting where they're going to be and when, so you can find out when those town halls are that are the in-person ones. Also, you can just call and ask, usually call the district office and they'll tell you. Virtual, a lot of legislators are now doing Facebook town halls, which is pretty exciting, or Skype. All those new technologies they're using to better work with their constituents. And a lot of legislators do teletown halls where there's an 800 number, you call in, they make some comments, you can ask questions. It's a good opportunity to let them know that there's people in their district who care about these issues. And if you take the time to physically go to a town hall or go online through Facebook or do a call-in, you're showing them that these issues matter to you. And there's other people who will probably not be as vocal in their advocacy, and so they would be, less likely to win out in some of these financial battles. The ones who win are the ones who are the most persistent, so that's the ones I want you to be. So all of these different action items, I gave you the 10, and again, the PowerPoint is available after the session as well as this recording, so you'll be able to enjoy it again and again and again. But you really want to take all of this and make it connect through your group. This little nexus point in the middle, this is where your group is. And they're influencing decision makers, you're developing stories that your group has, and you really are the people who influence the decision makers. So your group is right in here, and without that voice, we're really not going to be able to make a difference in the chaos that is both Washington, D.C. and the state capitol. And because I love those little Venn diagrams with the stuff in the middle, I know this is like a lot, so I'll just quickly explain why it's so critical now. I know Washington seems like a very frustrating place, and I tell you what, in terms of living here, I can completely agree with you. But the people who are going to win out in these battles are the ones who are persistent and the ones who get the most advocacy engagement. And everyone in Washington, D.C. is talking about how citizen voices are really what's going to be making the difference. And in many ways, I actually see the recent fiscal battle that we had an example of that, because legislators were representing the most vocal of their constituents. So the ones who felt that we should not extend the debt ceiling were representing a very vocal part of their district that agreed with that, and the ones who felt like they should extend the debt ceiling were representing their very vocal constituents. So I want you to be some of the vocal constituents, and you all have an advantage in that you are reasonable, and they want to hear from the grown-ups. So, all of these things are coming together in a perfect storm. The debt limits, the concerns about federal spending, some of the desires to eliminate funding for whichever one you decide to call it, this physical therapy caps, the physician and controversial bills, because some of the funding issues are in some of the most difficult to pass appropriations bills. These things are not going to be solved unless we speak up, and even when we find that we are disappointed in some of the reactions that we're getting in Washington, D.C., you know, the only way to make a difference with it is to really be heard. So with that, I want to actually open up one final poll, because I will feel like I was not very successful if I haven't asked you what you're going to do next, if you have any ideas from this. So if you can let me know what one of these things are, review current activities and see what you can recycle, learn about your legislators, tell others about the SAN action alerts, find your legislators on social media, or you're going to be brave and do all of the above and more. And while you're making that selection, I'm going to check to see if we've got any additional comments from our friend Coral. And so Coral, I'm unmuting your line. Please go ahead.
I just want to say thanks, everybody, for attending today. And hopefully if you can go out and advocate. If you have any questions, just let us know.
Great. Thank you, Coral. And we'll wait for all the votes to come in. And again, if you've been intrigued by any of this and you would very much like to be engaged but are concerned about how to do it, I am going to type into the chat box to everybody the email address, but it's easy. It's advocacy@stroke.org. And that's where you can find our friend Coral and her team, who will help you with any of these things that you would like to do. So I've just typed that into the chat box, and I want to make sure we get in as many votes as we can for what your next steps are. And thank you so much for being on this call. I really hope that you got at least one good idea out of it. All right, I'm going to close the poll. I'm going to share the results. So thank you. We've got a plurality of people who are going to do all of the above and more. So I really, really do these things. I can't tell you how important they are. I can't tell you how much they're needed. And really appreciate you taking the time. Get out there, go forth, and advocate.